We're back with another episode of Right Here in Mass. Today's guest is Dr. Timothy Osborn, a cranio-maxillo-facial surgeon, more commonly called a CMF surgeon. Through his 15-year professional journey, Dr. Osborn's surgical subspecialty focuses specifically on the shape, proportions, and features of the face, head, and neck. Outside of work, Dr. Osborn enjoys spending time with his wife, infant son, and rescue pup in their town of Lexington. Welcome to the show, Dr. Osborn.
Yeah, thank you so much for having me. I'm really glad to be here.
My pleasure. Please share more with our audience about you and what you do.
Yeah, so I started CMF Surgeons, which is, as you said, a cranio-maxillo-facial surgery practice. So I have now 15 plus years of being able to say that very, very quickly. Now, thankfully, most people just refer to it as CMF. So that's what we're going to do from here out. I started it about 5 years ago, and I'm sure we'll get through some of the professional journey, but it basically stemmed from I was taking care of a lot of patients on a daily basis, 40, 60, 80 patients within a day. And there are not enough hours in a day to do that as well as I wanted to do. And I was trained under an extremely high standard of care, paying attention to detail, paying attention to your patients. And I just wasn't being able to do it at the level that I wanted. And so, like most entrepreneurs, as I just said, okay, well, there's one way to do this, and let's just step out and do it. And I did.
Yeah. And so what was that process like of going off on your own?
It was exciting, terrifying, wonderful, awful, a whole mixed bag of emotions. But most importantly is it allowed me to bring who I was to the practice. And I think that was being in a big institution, it just gets muffled. And so, I had a vision for what I wanted to do. I had a way that I wanted to take care of people, and I was able to do it. Like anybody who starts a business, there are so many lessons that you learn that, I had somebody been able to give me a book and say, do these and you won't screw anything up. Great. But as anybody knows, it just does not exist. So it was a pretty significant transition. But what I kept focusing on is, I'm here for a purpose. I'm here for a reason. There's a way that I want to do this. So let's just dive in and figure out how to do it. It was a very big background of my training. So my training spans essentially the entirety of the human body and beyond. And anytime that I was in training, whether it's school, my residency, is I would just jump in and I would just find things to do, whether it was heart surgery, belly surgery, face surgery, I just figured out, here's something, I can learn something from it. It may not be pertinent in any way, shape, or form to how my practice will be, but it's going to be a skill set that I'd like to adapt and involve. And I did that with business. I didn't know what a profit and loss was. I didn't know what a balance sheet was. And so I essentially took some online courses just to figure out, how do I be an entrepreneur? How do I run a business? And I'm very good at the doctoring and the surgeoning bit, but getting to actually doing the very hardcore business elements of it, it wasn't there. And so I dove in and just tried to figure it out, and continue to figure it out to this day.
Yeah. And it sounds like you have built up a really awesome team that's been integral in that growth as well.
Yeah, it's culture, we have an amazing culture. I don't ever want to come into my office and be like, I just don't want to be here. I mean, that's anybody who has a job, there's going to be days like that. And that's just the reality of it. But to be able to have a place where you can just come and be yourself, we're a very collegial environment. I have the doctor word and the degrees and the things like that, but I don't care. I just want to come in and be myself, be able to just represent that with the people that I work with the patients that we interact with, the businesses that are by us. It's a way for us to be ourselves, and anytime you try to squash that, it's going to come back, and this is our manifestation of that.
Absolutely. And I know that your main practice is in Medford. And so I'd love to hear what inspired you to choose that location, or if it just happened to be the right fit.
Yeah. So, like most things, a lot of it is thanks to my wife. And I'm going to play that over and over and over so she can hear it. But my wife is an orthodontist, and we'll talk about her later as well. And our practice was in Somerville at that point. And she was working every other weekend at a dental office. And right next door is the place that we are sitting currently. And so she, for over a year, as the space was empty, and I knew I was looking for space. So we just built an operating room, and operating rooms require a lot of space and a lot of infrastructure. And so we needed to find that space. And I had been looking and looking and looking. And finally she's like, just take a look at this place. You couldn't see through the windows or anything, but it was a very, very big space. It was right at the time where COVID hit. And so just the reality of finding a rental and being able to get really a good deal this was the only time it was going to happen as far as I could see. So I saw it, and a lot of it was already built out, and I just tried to envision in my mind, okay, how can I adapt this space for me to use, and worked with a couple of different people to really make it a reality, and essentially find that this was the best space for us.
Yeah, absolutely. And I imagine that most of your patients come from the greater Boston area, but do you find that they also come from across the state too?
Yeah, so we actually now have global reach. So my furthest patient is from Australia.
Wow.
But yeah, so which for us, if you had told me 3+ years ago that I'm going to be doing a lot of my visits virtually and be able to say that I have a patient from Australia, I'd say it's not reality. But like most local businesses, is we have a lot of draw locally, but we also have the ability for people who travel. We're a pretty niche thing that we do, and there's not a lot of people across the country that do it really at a significant volume. And so for us, is people will find us, whether it's a web search or we're on a couple of different platforms that just highlight exactly what we do. And so they'll find us a lot from the Northeast. On a daily basis, is I'll have somebody from Texas or California or wherever it may be. But just like any local, is we always love the people that come in and walk by and see who we are and pop in and see what we can do to help them.
Absolutely. And with Boston being known as one of the best places to receive medical care, have you found that that's really benefited your practice and having even more credibility than you already do?
It's mixed bag sometimes. So Boston is a very competitive healthcare community, especially in the area that I am. Is it's above the clavicle, so there's only so many things anatomically that exist in your face, your neck, and so with it being a very, very huge draw for subspecialty and people coming from all over the world to get care or to provide care, is it gives credibility based on the fact that we're able to do it and establish ourselves on our own. So that's one of the best parts about it. But at the same time, it's you have to differentiate yourself, as you have to find that way to find that edge that people can find you. And I think that's really been one of the hardest parts of the journey for me is, I look at marketing, or have for a long time, as I don't want to promote myself, as that just, it feels unauthentic to me or inauthentic to me. I want to be me, and I want to be able to take care of people, but people aren't just going to randomly find you. You have to tell people about that. And that has really been a significant portion of the last couple of years for me personally, is just figuring out, you have a great message, you have a great team, you spent so much time and effort building up this team, why not tell people about it? And so, within that competitive market, is you have to find these things. And I think that's some of the internal struggle of, generating expectations that people may or may not want, and being able to reconcile that with what we can do. And, at the end of the day, is I'm taking care of people, and that always has to be my priority. And, that for me, I hold very, very personally, and I'm always going to keep that on the softer side of minimizing the amount of message that I get out there, so that people feel comfortable coming here and feel comfortable with me.
Absolutely. And going off of that, that's one of the things that, as we've shared in the longer bio within the show notes, is really the emphasis that you and your team put into the patient care and making them feel supported and like they're cared after during every step of the process. And so it's clear that what you've done, you've really helped to highlight that and everything, which is definitely one of your differentiators.
Yeah. Yeah, absolutely. It's, having been not only a provider of surgery, but a recipient of surgery, is you find very quickly is I think a lot of it becomes almost like the sale, the let's get them in the door. Let's, get the 7-minute visit. Let's do, essentially as our bare minimum to get the most billing. And it's just, that does not sit well with me. And so we really focus on supporting people through the journey, whether it's them figuring out you're not a great fit for us. Okay, great. Well, now you have a lot of information about what you were inquiring about, or people that work with us is, we're going to support them very, very aggressively as they're recovering. And I think that's a big gap in healthcare is you get them to the operating room, you get their surgery done, and then they're just off. And again, it's just something that just was not sitting well with me. So we have, we did a surgery yesterday, and we've already checked in 2 or 3 times on this person, making sure that they're doing okay. Because there are so many questions that come up. Nobody in that situation is going to read through a 30-page packet, which is our post-op surgical packet, to find out, well, can I shower today? So we find these highlights that can really help support people as they're recovering from an inherently just unpleasant process. Surgery is the S word. So.
Yeah. Yeah. And I think you absolutely hit the nail on the head, where oftentimes when people get medical care, it feels more like a transactional relationship. And so as you've described and talking about your processes, you're really showing that it's that long-term relationship, that even though the surgery may be done, you're still there for your patients after the fact.
Yep. And it's at our final follow-up visit with people, as I always tell them, we will always be here when you need us. And I don't care if that's a year from now, 10 years from now, if it's something that you need, that somebody you care about needs something, is we're here. And I think that is one of the bedrock principles of the organization that I wanted to build is we're here, we're longstanding, we're going to be here to support you beyond the journey of whatever care it is you're going to have with us.
Absolutely. And taking a few steps back, I'd love to hear more about what inspired you to pursue a career in the medical field, and also what inspired you to focus in on CMF as your specialty as well.
Yeah, absolutely. So I grew up where the Mayo Clinic is. And so, it's all healthcare. So it was a small town. I think it was about 50,000 people when I grew up there. And so, it was just a very, very different place to grow up than what I live in now. But everybody knows the Mayo Clinic, and they know the Mayo Clinic for a reason, is because that's why it built. Is 2 people came from New York and decided we need to take better care of people. And I think that has really been a very significant thing that has resonated with me, is there's a way to do it. It doesn't, I'm not a Mayo Clinic, and I have no desire to be a Mayo Clinic, but I really, really want to take good care of people. And so my dad was a nurse anesthetist. And so I would often, when I was growing up, I would go to the hospital. I have very early memories of what an operating room is, and just being around that and being around that philosophy and that culture, it really had a significant impact on me. And it was really, I think I was in my 3rd or 4th year of college and trying to figure out, what am I going to do? And there was always that healthcare in the back of my mind. And so, not really wanting to go to medical school at the time, as I actually applied to dental school, and I went to dental school.
Oh, wow.
And so, so I have a dental license. I'm probably the last person that you want to be able to do dentistry on you. But I do keep it active because, I spent the time and put in the effort. Very early on in my training, as I discovered, actually in one of my gross anatomy classes, is there was a head and neck surgeon who did a lot of cranio-facial procedures. And I remember his lecture very, very vividly. And I'm like, well, that's really what I want to do. And I think that was my 3rd week of school. And I went and I found the gentleman that gave the lecture, found a couple of other people. And I'm just like, I want to learn this stuff. And so I started going to the operating room and just seeing the things that they do. And that's what really kind of sparked this part of the journey for me. So after I did that, I went to medical school, and then I went to residency. Really ever since then, it's here we are. In terms of the field that I'm in, is it's your face. Everybody gets to see your face, whether you want them to or not. Not everybody gets to see your body, and being able to be a part of that journey and that impact of people. And essentially, we want to make them reflect themselves. We want to have them be able to reflect this is who I am. Everybody has a vision of what that is. They may not be able to articulate it, but you show it to them in a picture, like, yes, that's it. Zoom meetings and social media it has all brought all of these things very much to the forefront of, here's what my chin should look like. Here's what my nose should look like. And just being a part of that and being able to change some of the proportions and some of the things that we're able to do. Really, the magic is being able to be a part of that journey for somebody where they get to actually see that in themselves of the reconciliation of, here's who I think I am and here's who I actually am.
Yeah, you just shared so many good things. It's going to be hard to just pick a few things to really go deeper on. The first being that it sounds like a lot of the work that you do really helps to instill and bolster confidence in people. Because like you mentioned, I mean, that was a great point, that your face is the thing that everyone sees. And so when you feel really confident and good about yourself, you just exude this amazing personality and vibrance moving forward. And I think that's really powerful.
Right. Yeah. It's, I tell people not infrequently is, I'm in the confidence business, is to be able to look at yourself and know, yeah, that's right. This is exactly who I am. I mean, it's so fun to be a part of it, and really to engage with them and see them through that journey, rather than just, I see them for their consult, I do their surgery, and then that's it.
Yeah.
For me, it's really just being able to hear them say, not only thank you, but this is me, and I get to see that's my golf shot right there.
I love that. And I also think it's so interesting that you originally went to dental school, because your nonlinear career shows that people can still kind of find their way and figure out what they're really interested in and still have a successful career at the end of it. And I think that's another really powerful thing, is that you might not know right away, and that's completely okay.
Right. Yeah, 100%. If you had told me even a few years ago, you're going to run a business, you're going to have a staff, you're going to build an operating room, you're going to do all of these things, I'd be like, no, there's no way that that's going to happen. And then here we are. And for anybody is, if you're sitting there and you're not enjoying what you're doing, I have this passion for whatever that it is, just go for it. I think that's one of the biggest things that came out of COVID, and just the huge boon in entrepreneurship and people starting businesses, is people now feel empowered to just get after it, go do it. And they're finding the resources to be able to do it. And I think that's just an amazing thing for everybody.
Absolutely. You nailed it. And with you going to dental school, did you meet your wife there? Or is it just ironic that you married an orthodontist?
Yeah, no, I met when I was here in Boston. So I've been in Boston for right around 15 years. And so when I was at the university, that's where we met, is when she was still in her training. And so, yeah, it was really just very much by happenstance. And we had worked together a couple of times, and like a lot of things, it just kind of starts from some communication, and then you find out you connect and click, and there you go.
Yeah, absolutely. And you had also shared that your wife is an entrepreneur. And so I'd love to hear what that dynamic has been like with both of you being entrepreneurs, and how you still can kind of put business aside at the end of the day and have that time for your relationship, and also with your son as well.
Yeah. So, I mean, for us, there's a lot of blurry lines, and for how we interact, it just works. Whether we're talking about Jack as our son, whether we're talking about Jack, or, here's what happened in the business, we talk about our day, and just kind of, we really make each other better, I think is really the amazing part. She's a very, very good businesswoman, and we have very different personalities that I think complement each other. Is she is straight and to the point, and I'm going to take you 10 miles before you know what I'm talking about. And so just having that dynamic, is she has helped me become more direct, and I have helped her, be able to just kind of navigate some of the subtle elements of, just how you interact with vendors and patients and people. And so we really have been a very, very good match.
I love that. And going back to the patients and individuals that you work with, you do a lot of work within the LGBTQ community. And so I'd love to hear more about that and your involvement with gender affirming care.
Yeah, absolutely. So it was a huge part of my training. And so again, I grew up in a relatively small town in the Midwest. So diversity just it wasn't a thing,
Mm.
is it was a very white collar community. I had 90 people in my high school class. I think there was maybe one or two people of color. It was a very, very conservative community. So LGBTQ plus it just wasn't a thing. And when I went, so my training was in Oregon, my surgical training at my medical school, which was really where San Francisco, Portland, and Seattle were really three of the big places where transgender or gender affirming care started. And as I like to say, I'm the great, great, great grandson surgically of the person that developed a lot of the techniques. That's Osterhout, Dr. Osterhout. And he adopted a number of different procedures that were done for kids with misshapen skulls. And he applied this to people who wanted to have that gender confirming care. And really from very early on in my training, as I was exposed to it. And so, after getting over the initial, this is different, it's just people. People want to be treated like people. And that just very much resonated with me. And it's like having a good interaction with anybody is you really see the value. And then you see all the other, BS things going on around it. And they're just people. And so, really one of the most significant portions of my career now is helping somebody through that process. And again, we talked, your face is what everybody sees. In the gender confirming care is nobody, may know that you've had body work or breast work. But to be able to go out to the store and not be misidentified and be able to just go as you, throw on a pair of sweatpants and go to the store and not have to put on a wig or do makeup in a way that somebody won't do the point and stare or marginalize you in some way, shape, or form. I had three older brothers, and so I've been picked on, and everybody has been marginalized at some point in their life. And so to really take a community that just gets so much of that, and be able to help them and have them say, I was able to go to the store and nobody clocked me, or nobody was able to point at me or any of this, it's just, for me, it makes my day. And to have the skill set to do that, it's really it's a little bit of a superpower.
Oh, I love that. I got like chills just listening to you say that. Not that I want to speak for this community, but I can imagine that it's probably very frustrating to not be able to match on the outside what on the inside. And so being able to get that care probably feels like it's a weight that's been lifted off their shoulders and something that they've really been looking forward to. And I think it's wonderful that you're able to provide them with that. And like you said, ensure that there's hopefully more equity in places that they go to and ensure that they feel confident and comfortable in any environment.
Right. If I could do surgery on society and make it that people are just accepted, I would, but I can't. And so I have to do it the other way. And if we need to shape people so that they do look, like you said, like themselves, it's my job. And to be able to be part of it, again, I don't want to keep harping on the fact of how wonderful it is, but it's really wonderful. And just, again, being able to let them recognize who they are. And again, most people don't really want to be noticed, and this is what we're able to help with, and we'll get to the society stuff when we can.
Right. And I also think too that with the work that you do within that, it's very vulnerable. And so being able to have someone that they can trust and feel comfortable with, I think is huge. And from the care that you've put into your practice and your processes, it sounds like that you're able to achieve that with them.
Yeah. I mean, we sit and we chat, and we get to know each other, and I get the knock on the door. So, we book my consultations for X number of minutes, and my general tendency is X plus 15 or X plus 20 or X plus 30 because I just enjoy it, as I enjoy sitting and speaking with people and finding out, what it is that they're going for, some of the things that they have been through, just so many heartbreaking stories, whether cis, trans, or otherwise. We're very, very good at marginalizing each other and marginalizing ourselves. And so again, just having that inner confidence and that reflection of it in what you see it's really amazing. And a lot of it just comes from, again, it's treating people like people and being kind, and good old fashioned golden rule. I mean, it's not complicated, but it's complicated to do it.
Absolutely. And we've talked a lot about things that you really love and really enjoy about your career. And I'd love if you could maybe share the opposite end about challenges you might have faced or obstacles you've had to get through and things that you found to be difficult.
Yeah. So hands down, the biggest, struggles and hard things are running a business. Again, it was not my training. If you fall down, break your face, I'm the guy that you want to put it back together. But again, knowing some of the idiosyncrasies of managing people that you work with, building a culture, building systems and processes. I mean, these are things that I was just completely unaware of. As I'm sure most people who start in the way that I did, it's exactly how they are. So working through a lot of those challenges, I did just like I did my surgical training. Is I dove in and I took courses and I tried to figure things out, and I talked to smart people, really just trying to figure out what are we going to do. And again, it's anytime you step outside of yourself, it's uncomfortable. And so I think a big part of the journey for me has just been being true to myself. I'm a big mindfulness person. And that's also one of the things that if you said even 2 years ago that you're going to say that, you're crazy. So I meditate every day, and I try to tap into that inner reservoir so that, I can just give the best to anybody else, because if I'm beating myself up, I'm not doing anybody else any good.
Right. And I love that you mentioned mindfulness and meditation. That's something I personally have been actively working on getting better at. I feel like I'm getting better at not letting those thoughts creep in and not talking to myself. But I think it's really awesome that you've incorporated that practice into your everyday routine, because that was one thing I was wondering about, is that I can imagine your work is very, I don't want to say draining, but time intensive in terms of mental and physical energy. And so I'd love to hear kind of your, not necessarily what you do for work-life balance, but kind of how you transition from work into home life and ensure that you get the rest and relaxation you need.
Yeah. So when I was in residency, there was no such thing as work-life balance. To this day I hear a microwave beep and I'm like, is that my pager? So there was no separation whatsoever, and that for me personally has really been a significant challenge. And again, it just comes back to being true to yourself and just checking in with yourself and just, how am I really doing? I worked I think it was a 14-hour day yesterday. But I got home and like, this was a great day. We were able to, so we did a rhinoplasty and some contouring on a gender affirming care. And it's physically, for me, it's hard work. For the patient, it's hard work. For my staff, it's hard work. But to get home is, my son was, my mother-in-law helps us with him a lot. And he got home from a walk and that was it. I picked up my little guy and just, that was the rest of my day. So I think it's opportunity in the moment. And I think what mindfulness has really brought to me is just being present in that moment, and being able to adjust and just say, I'm here with Jack now, or I'm here with Ellen now, or I'm here at work now. Do it, knock it out, and then do something else that's going to be good for you, I think is really the best way. And then jujitsu. I started doing Brazilian jiu-jitsu about a year ago. So I was an athlete for a long time. And so I played football through college. And so running at people very quickly and running off of them, that resonated with me. And, so in my mindfulness journey, I was doing a lot of yoga and I have always been somebody who worked out a lot, but to be able to get that other piece in there, it's physical chess is probably the best way to describe it. It's a great workout. It's physical. You're more often than not, I'm getting thrown somewhere, but sometimes I'll get a good one in there. But just having these opportunities to just vent and be able to get out that energy. Whereas the easiest thing to do is just turn that on yourself and you're just going to destroy yourself. So just having that external ability to just get that stuff out it's really been very, very significant for me.
I love that. And I am a daily runner. So that's one thing that's like my non-negotiable. And I was just talking about this with someone yesterday, where if I don't incorporate movement into my day, I completely notice the difference between low productivity or low energy or just not having that mental clarity. And so I think it's amazing that you have the jujitsu and also your mindfulness practices to incorporate and really ensure that you're filling up your cup each day.
Right. Yeah. And it's, as I said before, is if you can't fill up your own, you're not going to do anything for anybody else.
Right.
And it's a big part of who I am, whether it's with my family, whether it's with my patients, whether it's with myself, is, it's doing that, is it's being in that moment, helping yourself or the people that are around you. And, it's just an amazing part.
Absolutely. And for anyone who's listening to this episode who may be considering going into the medical field themselves, whether it's for CMF or any other type of specialty, I'd love to hear your advice that you would share with them.
Yeah. Make sure you want to do it is the best piece of advice. I mean, my training after college was 14 years. That's a really, really long road. And I'm so glad that I did it, but it could have deflected off at any point. And so really the way that I just kind of figured out the journey is I threw myself into it. Is I went and I saw surgery, and I made sure I really like surgery. I can stand on my feet for 12 hours a day, and I may have blisters on my heels at the end of it, but I don't care. It's finding what you're passionate about. And I think one of the great things about just how we are as a society today is we'll accept that. For the most part is I want to do X, Y, or Z. And it's like, well, great. Let's help you do that. And there's just so many more resources to be able to figure these things out. And so I just encourage people, just be courageous about it. If you want to do something, go make sure you want to do it. And if you find I don't like this, then don't do it. It's just really, again, just being true to yourself, being honest with yourself and saying, yeah, this is something I want to do. I explored it. I was wrong. Admit it, move on, and find what you really want to do.
Yeah, smart advice. And with you living in Lexington, and of course, having your office in Medford, I'd love to hear if there are any businesses that you like to frequent and support local.
Yeah. So the top one is my wife. She's at Seaport Smiles. She is a amazing orthodontist. She works mostly with adults, Invisalign. She and I work together a lot. There's also, as part of my journey with becoming an entrepreneur, as I've worked with a couple of different people. Deb at Boston Business Growth she helped us through a very tough transition, moving spaces, building things, implementing business strategy. Rhodes Consulting is another one. A good friend of mine, Jose Perez, is the CEO of that. And he's somebody that I can always get really, really good advice from. I'm not a big person that likes to go out to restaurants or things. Being in the medical field, is you often learn that food is fuel, and that's flavor is really not a thing. But we are right down from Donut Villa, and Donut Villa has great donuts. They have very good breakfast sandwiches, which, just in anticipation of this, as I went and I bought one this morning. But being a local entrepreneur is you really find just that business to business and that local connection. And you just find, well, we connect in this way, and maybe there is and maybe there isn't a way that we can help each other out, but just that community of people that are going through a lot of the similar struggles it's a very, very powerful thing.
You nailed it. Dr. Osborn, this has been a wonderful episode, and I've appreciated the opportunity to learn more about you and all that you've done. And I'd love if you could share with our listeners where they can find you online in case they'd like to connect with you further.
Yeah, absolutely. So we have our website, which is cmfsurgeons.com, Cat Mary Frank. We're on social media on a number of different platforms, which is usually at CMF Surgeons. And you can find us and find out who we are. And if you need anything, we'll be here.
Fabulous. I'll link to those in the show notes. That way people can click through and connect with you from there. But thank you so much again for being a guest on today's show.
I really, really appreciate the opportunity, and it's really been nice chatting with you.